Dads. I'm one, but I kind of live and die by myself. All right. In 3, 2. Good morning and welcome again to Pain to Power right here on Legends 100.3. I'm Mike McGann, and with me is my buddy Dave, as in David Kashuba, Dr. Dave, who is the owner of First Rehabilitation of North Palm Beach. They sponsor this program. They bring it to us. Dave is a great guy and a dear friend. Good morning, Dave. How are you?
Good morning. I'm doing pretty well. Yeah, we wanted to bring this program to people just to kind of learn what to do and what to avoid. And I wanted to bring on some of the local superstar orthopedics and different doctors, varying doctors that we have so much in this area. We have so many great doctors. And a lot of times you're listening to the people by the pool who to pick, and they don't choose, who to pick or which one to go to.
Who's prettier?
Who's prettier? Speaking of who's prettier, today with me I brought a good friend of mine. Although we've never met in person, we've done a lot of work.
I know I don't live up to Dr. Wiener or Dr. Alkatchin or Dr. Simovich in the years
75 years younger than those guys like us. But we have Dr. Vani Sabesan, and she we go to her for any of our shoulder problems. She is fantastic, and she's good at what she does. But not only that, is the techniques that she uses. And I wanted to bring some things up because last weekend we spoke with Dr. Ryan, and he was talking about what to do and what not to do following a reverse total shoulder.
Reverse total shoulder, exactly.
Here we
like
go.
You imagine.
We'll keep this short because I know we spoke a lot, but with Dr. Vani here, her reverse total shoulder, she's trying to get you to reach behind, put your hand in your pocket within a couple weeks, where everyone else is like, don't do it for 4 months. Mm-hmm. And so I kind of wanted to head this off and kind of piggyback what we were talking about last week, just to say, what do you do differently?
Well, I think it's interesting, right? There's sometimes we build techniques based on legacy. Sometimes we do legends, and sometimes we do evidence. So I think sometimes it's a little bit of all, right? And I grew up and was trained by some legends. And Dr. Iannotti was one of the greatest legends and helped develop the techniques of shoulder arthroplasty, some of the first systems. But I also live by his words of evidence. And so we decided, patients, you're in Palm Beach. Do you want to spend 6 weeks in a sling, or would you rather start moving tomorrow? And we sort of said, let's push the envelope, because my mom has had 2 reverses. Just because you're 76, not driving for 6 weeks can really disable you from your life, your lifestyle, your family. She drives my kids to school. And so really, we said, what if we get people moving earlier? Our techniques have gotten better. We can push the envelope and get people back faster. And so we did a head-to-head study. We actually did one of my partners who did 6 weeks in the sling, and I did people in a week or a few days afterwards. You start moving it right away. And we found that the outcomes were similar. No complications, no loss to a patient. And in fact, at 6 weeks, they're doing a ton better. So sometimes evidence shows it, and you have to change what you do. You can't sit and stay the same as a surgeon for 30 years.
Those are words that are really, really powerful when it comes to just about any profession these days, but medicine in particular. People get very, very set in their ways.
Absolutely.
In this profession. And it's really kind of refreshing to hear the opposite take on that. All right, let's see what we can do now. We have the technology. We have that legacy to build upon that was built by these legends. Now let's stand on the shoulders.
And I think, being a female, we sometimes listen a little bit more. There's some good evidence to say that there's some studies that show that maybe our outcomes are a little better, but I think it's more just about the patient-centered care, right? I mean, you listen to your patients and you hear what their needs are, and you try to advance what you do, how you do it with that. I think also I listen to my mentees. I have a lot of young people. I have young guys in the OR, reps, students, residents, and they'll sort of say, hey, why don't you try doing it this way? It might be better. And you sort of have to always take everything with a grain of salt, try to make sure that we have some evidence behind it, but make it better.
That's one of our problems as being a therapy company.
I think so.
We have to know what the doctor intends their patients to be able to do, which doctor plans on discharging when they say, which doctor trusts you and your decisions on how to upgrade them, how to kind of push them along or make sure they're not being pushed too hard. And that's one of the difficulties. But with you, it's it's refreshing because we get to think and what we feel, because you could really tell right away, first visit, whether this is going to be a good outcome or a bad outcome. And again, with her reverse total shoulders, I've had nothing but good ones. But we're going to kind of change the subject to.
Can I just say one point on fit therapy, right? We all talk about sort of medicine now, right? And it's sort of become depersonalized, and you go in, you're like a number in the cog of however many patients. Therapy, we did a survey study on therapy, and we looked at all of our shoulder replacements. We said, how important is this to you? And 98% of patients said the therapist was a huge impact on their outcome. And 95% of them said that their therapist changed what they did, how they did it. And it's like having a hairdresser. They talk to you, they listen to you. It's the company you need. So whether you're remote in telemedicine and therapy, whether you're in person, it's a huge factor in everything that we do as surgeons.
I think it's something we've addressed on this program a few times, is that no two people are alike, no two personalities are alike, no two bodies are really built the same way. The general framework is going to be the same, but everybody's going to require something different. And the personalization aspect of that, it sets better outcomes apart in a way that I think would seem to be pretty predictable.
I think it's a great point, and maybe I'll just bring up, we wanted to talk a little bit about technology.
Oh, yeah.
And I think that's a really important part of where we are going in orthopedic surgery. I'm part of a company on a design team that they're personalizing implants. They 3D print the implant for you. And can you imagine?
One of my topics.
Yeah,
I was going to ask you about.
So you imagine, like, obviously, if you think that if something's made specialized to you, it might be a little bit more tailored to you, your anatomy, your size, and hopefully that would just sort of get you in a better place, better outcome, back to the gym fast or whatever it is. But that's where sort of the technology's going.
That is really kind of mind blowing. To think how far we have come in keeping it personal and getting better outcomes.
No, I was just going to bring some points up because I have a feeling I'm going to try to sit back and let Dr. Vani here do the talking, because she's great.
Yeah.
But I understand that recently, over the last 75 years, the Florida Orthopaedic Society has never chosen a woman to be president.
That's right.
However,
that's right.
There's somebody that we know that's the president and chosen one. Wow.
Yeah.
That's a huge feather in your cap.
Well, I think it's not about my cap. I think that I created hats, and actually all my mentees, I have a couple of research fellows and med students, they helped print out hats, and it says first of many to come. So I think that's really the legacy I want to leave. I'm just the beginning of a really good legacy.
I want to mention a way that you can learn more about Dr. Vani. It's just that she's got a number of ways you can track her down. Orthopedic Center of Palm Beach County, ocpbc.com is a website to look at, ocpbc.com.
Come see us. We have 6 offices, I think now, or I'm counting. A place we're going in Jupiter. We have Lantana, Lake Worth. We have Boynton Beach. We have Wellington, and we have 2 offices in Boca.
All over the place.
Yep.
That very easy to track down. Also, of course, your name, drvanisabesan.com. That's drvanisabesan.
Yeah.
.com. And yourmedmom.com, which I think is a really interesting kind of.
Yeah.
Let's chat about that.
Super fun. So, sometimes I think things come to you. You create your own things, and sometimes the legacies follow you. And I have had the privilege of training probably over 100 med students, probably 50 to 100 residents. And, it's my passion. I think leaving the legacy is so important. Teaching and training people to be better. The reps give me crap because they call me a spitfire, but I think it's the idea is that you want to teach and train people to be the best versions of themselves. And so my mentees came together and said, it's so funny how you are, because you sort of tell it like it is. Sometimes you tell us things we may not want to hear, but they're the best part of ourselves to make us the best versions of ourselves. It's sort of like what your mom does. Your mom might not always tell you stuff you want to hear. Maybe it doesn't tell you stuff that you even like hearing, but sometimes you need to hear it. And sometimes always the premise of your mom is usually for your best interest. And so that's what your med mom did. They said it would be real advice for women and people who want to train in orthopedics, in life, and being successful as an athlete. So your med mom is sort of a career in surgery and orthopedics.
All right, well, career surgeon in orthopedics, now, of course, the first female president of the Florida Orthopaedic Society. So a ton of feathers in your cap to match the hats.
And she keeps referencing to her left. My son Nick is sitting there trying to stay out of the picture.
That's right.
He was a trauma orthopedic sales. He did a lot of work with Dr. Sabesan, and so the type of work and the type of information that we got from him and the different doctors. Not only was she good at what she does, she was friendly and became friends with the reps.
Yeah.
Where other people sometimes would look down at the reps. And
it's a team.
That's something special that is given to you.
And I think that's where your med mom came from too, is just sort of the idea of like your mom is like part of your team and I'm a team builder. I really believe that, I think especially in the OR, it should be a really fun place to be. I love it. It's my happy place. And so I think we really try to do that. Like I had 2 students today in the OR and they said it was the most fun they've had. And I think, part of it's just making it that sort of friendly environment where you learn. You're efficient. We build our techniques. We do really good work, but you still have a good time.
Everybody wins in that kind of a situation. Yeah. That's a fascinating website, yourmedmom.com. We touched earlier, and David started talking about this while we were on the air, about technology.
Yeah.
And I know there were some specific procedures that you were interested in discussing, as I recall, because you used some terms that even I didn't know.
Well, listen, you guys are educated. You're learning all about reverses. You're learning about all these things. And I think, the important thing is it's exciting time to be part of orthopedics for me. But technology, I think I hope that we find technologies that help solve problems. And I think sometimes we have these advancements, like the iPhone is an incredible device that does it. Now, do I think the 16 or the 17 version of it maybe is solving a huge unmet problem? Maybe not. And I think sometimes we think about that in technology, in at least my industry, because we're very implant driven. And so a lot of times we make tech for tech's sake. But some of the things that we've been looking at that I'm pretty passionate about is just things I think that from a research standpoint are going to change how we do it. And one of it is muscle sparing. This idea that you could do a shoulder replacement or a joint replacement and you wouldn't have to cut the muscles.
Subscapularis.
For example, the subscapularis. So the subscap's in the front of your shoulder, right? The subscap, if you cut into it, needs to heal like any other muscle you do. And that's a restriction for 6 weeks. And it sometimes can lead to lifelong problems, right? So imagine if I did a shoulder replacement without cutting that muscle ever. First of all, you have no restrictions to start. You get back to work. You have no limitations. And then you can get back to doing things and you don't have that risk of it failing down the road. So the fact that we've even developed techniques to be able to do something like that from a rehab standpoint, from everything, is pretty cool.
One other thing I wanted to ask you about is the patch augmentations that you use, biologics. Are you doing?
So that's the other thing. Rotator cuff repairs. I think 17 million people suffer from a rotator cuff. Probably anyone, if you sat next to you in any sort of retirement home community, any sort of thing over 60 living, 1 out of 3 people are going to have a rotator cuff pathology. And so what we know is that they occur. We're really good at fixing them. We're not great at getting them to heal. And I tell people in Palm Beach, 90 is the new 70. And the reality is, guess what? Our blood cells, our biology isn't as good as when we were 20. So if you can create some sort of scaffold to make that better, to give you a better chance to be 20 again or 40 or maybe even just 60 again, you're going to get better healing of that rotator cuff.
This, again, you're doing something that I've always found fascinating here, and that is, we've talked about this too, Dave, understanding that the body is a self-healing mechanism. If you let it be, you're replacing what needs replacing and letting the body itself handle the rest of it.
Yeah.
What about doing replacements where you do partial replacements?
Well, yeah. So, I think there's some newer things out there for that. So some things are called stemless, or things that are 3D printed to get your bone to heal into the implant. And then there's other things that now we're changing what kind of metals we use. So pyrocarbon is another one. And that pyrocarbon means you don't have to actually put metal on both sides of the joint. You probably could just do it on one side of the joint and it won't wear away or cause the same levels of pain than trying to do both sides. So that's kind of what we think of technology, right? Tech for tech's sake versus tech, solve your problem, make you have less pain, maybe make you recover faster, make your bone grow better, make your rotator cuff heal faster. So that's kind of, to me, the tech that we should all be talking about.
Actually making a difference.
Yeah.
Tech as opposed to, look how cool this is.
Absolutely. Robots are the big thing, right? So robots have affected a lot of other parts of medicine, but in shoulders and joints, total hips and knees, there's actually been not a lot of science to say robots are the next panacea. And we all think of going to a surgeon that does robots. It's a great marketing tool, but ultimately you're not solving a simple problem and you're not adding anything beneficial to the patient.
From my side of therapy, robotic procedures, especially in the knee and the hip, and I've seen worse outcomes than a doctor that actually knows, that looks at anomalies where the robot knows exactly what to do, but it doesn't always know what not to do. And that's
wow, that was a really profound statement. Actually, no, like it was. I mean, that's actually that's
squirrel finds a nut.
It's the modern dilemma, right? I mean, it really kind of is. That's kind of a modern dilemma in medicine.
Yeah, I mean, it's like AI too, right? Chat can get you so far, but maybe not always accurate. You talk about anything, and the technology is as good as the user.
Well, just even knotless. I'm sorry.
Knotless rotator cuff. Yeah,
it make a huge difference in the healing process.
That's right.
And some people who.
Like I started using knotless sutures probably 14 years ago because my residents and my reps said, "Hey, maybe you should try this." And at the time, it was a heresy to do it. And just look what we've come through now.
Germ phase theory was a heresy at one point. So I mean, come on.
The only bone to pick that I have with Dr. Vani is that, and it wasn't her fault. They moved her away from Gardens area.
That's right. I had
we had such
great shop down the street from him. Yeah. So we're coming back though.
Coming back.
That's right. We're looking at 2 spaces.
So.
I do want to backtrack just for a moment because I want to give a little information about First Rehabilitation of North Palm Beach, since they present this and they're where right near where you used to be.
Yeah.
Right here in this area. You can learn more. Dave, of course, is the owner and founder. The website is firstrehabnpb.com. Spell out first, FIRST rehabnpb.com. You can also give them a call at 561-624-GAME, because they keep you in the game. It's 561-624-4263. This location geographically is very interesting from a medical standpoint, because we do have such an active yet aging population. It's not really something you find anywhere else, and that determines an awful lot of what you all are doing.
We have 90-year-olds coming off of pickleball courts.
It's crazy.
Tennis
well,
courts.
And I'm going to put a plug in for Dave and First Rehab. I think that we also have a lot of young athletes, and I think we have a lot of growth in terms of families. We all have kids, and the athletes are just incredible. But the problem is, in Florida, we have the indulgence of being able to play all year round.
Yeah.
And Dave is an expert and sort of a scientist of trying to get people back to their game.
Thank you.
And I always send him these difficult athletes, and he's gotten people back to MLB level. These athletes back to playing and being recruited by national, international superstars. But I think the thing is that we really have to realize that rehab science in these sports is just as critical, probably maybe more critical than even or as much of our surgical treatments. Tommy John surgery, rotator cuff surgery. You talk about tennis players, you talk about pickleball players, baseball players. And I think that I've sent you a lot of tough athletes. And I think you really enjoy those challenges.
I do.
You find the science of it. And not every therapist does that,
That's nice. Sometimes the people you don't enjoy, the athletes, yes, but their parents not always. Because some of them that are not quite MLB level, sometimes the parents have that feeling that they may. And
well, everybody's special.
Yeah, that's
Well, even the 6-year-old that plays pickleball competitively, that plays 6 days a week. I mean, they'll come in. I have people in my neighborhood that come to me. They're like, "Just shoot me up, Doc. Just get anywhere that I can so I can keep going."
I have a funny story. When I came down in 1990, and I started the St. Mary's Rehab floor way back then. And one of my first patients came in, and they said, "Dave, one thing, just let me do whatever. I'll do whatever it takes, but just don't stop me from golfing."
Yeah.
And a little light went off and said, "Cha-ching, these guys are all for all about golf.
Yeah,
And
yeah.
so then we started golf programs. We have specialty programs. We have
Yeah.
throwing programs
Yeah.
that you're involved with directly and sending people over. But we do what we can to get you back. And it's not always playing in a game. It's not always getting up, getting the ability again to reach to the top shelf. But we take everything that you say and we put it into your plan of care, because whatever you tell us subjectively is how we make our assessment and objectively treat you by your subjective complaints. A lot of times people will come to you and I, and they'll start saying about their shoulder, and then they start telling me, it really aches at night. And so now you're looking more at a bursitis and a tendonitis and little things like that. You don't realize how important it is to have your therapists take really good notes and listen, like Dr. Sabesan said. You got to listen.
Well, I think it's a lot that we talked about earlier about just being the personalized medicine. I think that, technology, technique, rehab, all of it has to be tailored to you. I mean, that's the best success.
Sure. And what you're talking about here is the difference between surviving and thriving. Yeah. You know what I mean? I mean, quality of life.
Yeah.
It's been a buzzword for so long, but it's very, very true.
Yeah.
You want to modify, not have to change your lifestyle.
Well, shoulder replacements and shoulder replacements used to be sort of, people were really apprehensive to get them. They thought it was the end of your line. And, we have one of the guys that helped develop the first reverse shoulder replacement is a heavy lifter, competitive lifter. And so we have people doing things. I had, not that I would want to know, but a couple, DECA and what is the other competition for lifting? And they have a shoulder replacement. One of them had a rotator cuff with an augment, and she's competitively lifting back to her high levels of, really competitive heavy stuff. And we're able to do that. We're able to get people back to those levels.
That's just that would be terrifying to me.
Yeah.
I mean, to be someone who would go to powerlifting after a replacement or a torn rotator cuff. But, you trust our technology, and it's certainly earning the trust.
Now, do you do revisions?
Absolutely. I think I probably enjoy the complex stuff the most. I get sent a lot of it probably because there's a lot of people that do great work, but maybe not stuff that they don't want out of the box. And I think that what our goal is with the revisions really get people. I mean, I really, no one is at the end of the line to me. We always have a chance of salvaging, making something better, making them back. I mean, I've run 28 marathons. If you couldn't be able to exercise, you really should at least be able to have a chance to do something. And so I think revisions, a lot of times we say to people, we used to say we can't do anything more. And I just think our technology's gotten better and better.
Just going back, you ran 28.
Oh, yeah.
Man.
I think that's probably why I love what we do so much, right? And I still
competitiveness in you?
No, just a little. I think I won one, and the coolest part about winning a marathon is one of my senior residents took a job in Delaware, and was the guy that gave me the award for the winning the marathon.
Oh, that is really neat.
Isn't that cool?
Yeah.
It seems to be you're also competing with yourself.
Oh yeah.
That's got to be a big
one,
right?
Yeah.
It's so interesting, and I have one question because we're running a little short on time, but the future of it, the future of the technology, what do you envision? What would you like to see?
I think that as we continue to get better and better at what we do, that we help people stay more and more mobile, to stay and enjoy sports and just an active lifestyle later in their lives. I think early in their lives to make young athletes be able to have sustainable careers, and then older athletes to be able to keep doing what they love. I mean, I have a 90-year-old that just came in 2 days ago, and he still exercises 6 days a week. If I can do anything to be a part of that journey to make him do that well, and to do that, and if we can get surgery to get people back, that's really a blessing for me.
I have a feeling you're going to say or listen and agree with what I say. We're going to have her on.
Oh, there's no doubt. I feel inadequate enough most of the time.
You're exercising 6 days a week.
I mean, well, come on, get to it.
I keep active in
my. My facility is so far away. He can't. It's pretty hard to get in traffic. What would it take you?
Listen, as long as you're staying active in whatever way.
But one last thing, because I always find case studies so interesting.
Yeah.
What is your favorite, most interesting case that you've seen? Why?
Okay. There's a guy. He actually runs one of the country clubs up here, and he was. I think he'll be okay with me telling his story. But he was on a bachelor with a group of guys on a guys trip in Nashville. and he got hit by a drunk driver, and he got his arm crushed. His elbow was destroyed, and he was at Vanderbilt Medical Center, and he said you could get emergency surgery here, or there's a friend of mine who lives in Palm Beach who you could come and go see. And ironically, it was me. And he had already looked it up and made an appointment and came in, and this guy said it. So he said it was meant to be. He flew back, and he had probably one of the most difficult blasted elbows you've ever seen. And he had nerve damage, severe nerve damage. And imagine, he's a country club manager, does everything. And he's actually worked with Tiger Woods. And so a really great human being who really didn't ask for this to happen. A year later, so we went through a single surgery. The surgery didn't heal, still had nerve damage, severe. The most optimistic guy you've ever met. We took him back for a revision surgery, and 6 months later he's back. He has full function back. He got his nerve damage turned around with the revision surgery, which he never thought would happen. 6 months he waited nothing, and now he's got his full elbow range of motion. And he sort of said, we joke, but we gave him his life back. But I mean,
it's not a joke. That's what actually happened.
But
that's legit.
But his attitude, I said, is what made it all.
That's why I love our field, what we do.
Yep.
That's so amazing.
Yep.
The attitude is so important, but it's
so
also
good.
your attitude. Both of your attitudes.
Oh, I mean, he's a great guy.
Your attitude, Dr. Vani, and yours, Dave, as I know, it's very patient focused. It's very, wow, we're lucky. We're amazing that we can get to do this. That we have this technology. We can change the lives. That attitude helps to change.
And to save a guy's arm, I mean, for what he didn't have that, that's the thing.
It really is. And I mean, it's amazing how quickly the time goes. We're just about
done.
And
I was thinking that there's a guy who's sitting at a bar.
Yeah.
Okay.
You're very upset, and the bartender walked over to him and said, "Hey, what's wrong?" He's like, "Well, my girlfriend of 6 months left me. He goes, oh, here, let me buy you a drink." So he had a drink. The guy went on talking. He's like, she left me because she thought I was so un-American. And the bartender shaking his head, and he goes, "I didn't see that coming from a kilometer away." But only the American people will like that one.
When I use that joke.
Thanks,
you will not do that.
Yeah,
I always do.
He does.
Man,
he does.
I throw credit all over the place. This has been a really fascinating show. Dr. Vani Sabesan, thank you so much.
Thank you guys for having me. I appreciate it.
Life changed and given back. DrVaniSabesan.com.
Sabesan.
Did I say E?
Yeah, it's all right.
My reading glasses were off.
It's okay. Sabesan.
Sabesan. Your medmom.com and ocpdc.com, and of course, Dave with First Rehabilitation of North Palm Beach. Dr. FirstRehabNPB.com, FIRST RehabNPB.com, or 561-624-4263, which can also spell game or hand, depending upon what you need. This has been Pain to Power on Legends 100.3. Great show. Stick around. Lots more legendary programming.
Yeah, he makes it easy. I was gonna
really good.
Yeah,
that was a great show.
And I was gonna get more into letting people know that you do more than their shoulders. Yeah. I didn't have a chance.
That'll be the next show.
You're so interested.
There was a lot there.
Yeah, you're able to just carry us on your shoulders.
Well, you're dynamic, and not everybody is.
Yeah.
I mean, that's something you run across.
Yeah, you're very good.
There's a degree of dynamism
I like
that's useful.
that's why the med moms, they want me to do this, like what you guys are doing.
Yeah.